Good morning, everyone. Welcome to our CPR virtual training class. It's 10 a.m. and we would like to just give a minute or two for people to be able to join our virtual CPR training. So there will be a period of silence for just a minute or two. Thank you for tuning in, and we look forward to speaking with you soon. If you're just joining, we will be going live in about 1 or 2 minutes. We'd love to hear from you in the chat, so you let us know that you're here. And if you are tuning in and you can't stay for the entire presentation, this presentation will be captured on this Facebook page, Cook County Commissioner Donna Miller, and you can view it later. We appreciate you joining us live today, and we will be getting started in just a minute or two. Thank you. Thank you, Felicia Hardy and Brenda Wallace, for saying you're here. Glad you're here. Thanks for joining us. We will be getting started in just a minute. Thank you so much for joining this morning. Good morning, everyone. Thank you for joining our virtual CPR training. I'm Cook County Commissioner Donna Miller, and we're going to share with you some vital information related to CPR. And I think one of the best things that we'll learn is what CPR actually stands for. But we do know that CPR is a vital heart, it's related to your cardiovascular, but it saves lives. During this month at the Cook County Board, it was my honor to present a resolution in support of American Heart Month, which is the month of February. And it's the month of February every single year. We have to raise the awareness of cardiovascular disease, not just in Cook County, but across our entire country. In Cook County, heart disease is the leading cause of death at 25%. Cancer is next at 24%, and it accounts to nearly half the deaths of both jurisdiction-wide and within all 4 of the public health districts. That is why it is so crucial and urgent that we learn whatever we can do to mitigate having anyone die unexpectedly from heart disease or a heart attack. Heart disease is especially high in the African American communities, which report higher rates than normal here in Cook County. The mortality rates for nearly all reported categories were greater in southern Cook County, and that's the area that I represent. We do have the great honor of having a virtual CPR training contest here at Cook County for all of our employees. So we're hoping that anyone who works at the county will take advantage of the training department's program, and that we're going to have a contest, and the winner will get to win some exciting prizes. So without any further ado, I would like to introduce our speaker for today, who is from the American Heart Association and will be sharing this CPR training with us this morning. I'd like to welcome Micaiah Isaacs from American Heart. Micaiah, could you please just take a moment, introduce yourself, and then we'll get started with the program.
Alrighty. Hi everyone, I'm Micaiah Isaac. I'm a certified CPR and first aid instructor under the AHA. I've been doing a few classes. I love having the classes. I always have fun with my students and just not so much fun because it is really important, but I feel that everyone should have CPR under their belt. Some jobs require CPR certification, some don't, especially like babysitters. And I think it's just really important for everyone to learn, especially parents and babysitters, but just really anyone. And it's great for everyone and everyone. Yes.
Well, great. And so, Micaiah, just tell us a little bit about your role at American Heart Association and the importance of CPR and what CPR actually stands for.
Yes. So CPR stands for cardiopulmonary resuscitation. My role, I mostly do CPR, hands-on. So when you attend a class, or just even if it's my class or anyone else's, you do get a chance to practice because it is muscle memory as well. So they have, the American Heart Association has online where you can look at videos, but the best is to actually take classes. So that's what my role is. I do classes. This is my first virtual training, so I'm really excited about this. And there is a percentage, most 70% of Americans don't know CPR. A lot of people die from it, and the chances of survival for the person doubles every minute that you provide CPR.
That is crucial information. And the other thing I wanted to mention, Makai, before you get into your full presentation, is something that we highlighted in our resolution as well about the bystander effect for CPR. So the bystander effect shows that it's really troubling, especially in African American and Hispanics communities. They're 30 to 50% less likely to have a bystander perform CPR. And if they suffer from an incident compared to in a Caucasian environment. So the reason we call it the bystander effect is because many times when someone suffers a cardiac event, they are not alone, there's people around. So if the bystanders actually know CPR, it increases the chance of survival. And I'm sure all of your statistics that you talk about in all your classes greatly increase when people have been instructed and know CPR. So I'll let you go into your program now, and we hope to learn a little bit more about CPR. We also hope that if you're watching today, that if you're sharing this information with other people, please let them know the importance of knowing CPR and watching this instructional video. Thanks so much.
Perfect. Alrighty, so first I'm going to go over the difference between cardiac arrest and a heart attack, because most people think that they're the same, and they're not really the same. So cardiac arrest occurs when the heart's electrical system malfunctions. It causes an abnormal heart rhythm and can cause the heart to quiver. Other reasons that might cause cardiac arrest is scarring of the heart tissue, recreational drug use, or Wolff-Parkinson-White syndrome, which is mostly in kids. A heart attack occurs when your coronary arteries become blocked. So cardiac arrest and a heart attack aren't the same, but they both can lead to unresponsiveness. And a heart attack can actually lead to cardiac arrest. CPR helps keep the oxygen and blood flowing. It increases the chance of survival. If CPR is given within the first 2 minutes of a cardiac arrest, the chances of survival does double. 70% of Americans aren't prepared in certain situations, or they feel helpless to act, or they just don't know and have no training in CPR. And it's best to give CPR to someone who doesn't need it than to not give it to someone who does need it. And you're not going to hurt anyone. And even if you do, those like a broken rib or anything are minor compared with death. AEDs are another thing that are really useful. You might see them in different places, like if you're in a workspace, they have them, usually they're attached to a wall, kind of like a fire extinguisher. You'll see them in like malls. I've actually seen a few in parking garages. But even like a lot of people don't know what those are, and I actually am guilty of that. I just would walk past them all the time before I was ever certified with any CPR. I just walked past it, never really paid attention to it, didn't really care to learn what it was, but they're actually really important. AED stands for Automated External Defibrillator. It gives a shock to the heart. A cardiac arrest was like the heart quivers, so the heart's like shaking. That shock from the AED shocks the heart so it can get back to its normal rhythm. And same with the heart attack. Sometimes heart attack can lead to cardiac arrest. And the heart attack, the artery is blocked, and that can also cause the heart to quiver, which is now no longer a heart attack, it's now cardiac arrest. The compression depth for an adult, a child, and infant are different. So with CPR, which I'll demonstrate in a second, but with CPR, there's compression depths. So for an adult, the compression depth is 2.5 inches. For a child, it's 2 inches, and for an infant, it's 1.5 inches. So that is the depth that you're pushing on their chest to pump that blood through that person's body. I will be giving a demonstration on an adult and an infant. And then also I'll just go over just quickly a few things about choking like in an infant, because I feel that a lot of people don't know that as well. And sometimes that can also lead to unresponsiveness. And then even though if it's not cardiac arrest or a heart attack, you still would need to provide CPR. So I'm going to grab this here. So for this part, I'm not going to move to the floor. So we have our CPR mannequin. This is the infant, and they move. So if you came to my class, you will get a chance to practice all of this. So you don't want to hold the baby upward. I'm just doing this so the camera could see. So when they're laying down, you want to have your thumbs right at the center of their chest. This is for infant. These mannequins also have lights on them so you can see. Red is dead. Two green dots mean you're doing good. One is probably you're not going fast enough, or you're going too slow, or you're going too fast. So this is, I'm trying to see if it's a good angle. So if you could see, that's how far you want to push. That's 1.5 inches. And these also have clicks to let you know if there's no click, you're not going far enough. So if my camera is picking it up, you hear a click. So that's for infants. Some people might have arthritis and can't do that with their fingers. So you can use the palm of one hand, and you don't want to do 2 hands because you don't want to go too hard. Even though the AHA says that it is okay to go too hard than not hard enough. For the adult part, we are going to be going to the floor. Okay, she said that was a good angle. Okay, I'm going to be moving my camera to the floor so you guys can see the difference between the infant and a child, or adult and an infant. But before, I just wanted to go over these masks. So a lot of AEDs, some AEDs might come with these. And then there's also these as well. These are face shields. I don't want to open this one because this one I might give, this is for a student. But it's almost like a face mask. And with COVID, you know, people might not want to put their mouths on other people's mouth, especially if it's someone that you don't know. If you're in a store and no one else knows CPR and you're like, well, I'm certified and taking classes, those pocket masks are good to keep on you, just so you know there's no germs with you and the person. But these masks, they go over your face. Once again, I don't want to actually put on my face because these are for class. They're going on your face. My instructor, she called them C's and E's. So your C's will hold the mask in place, and your E's will help tilt the person's head back. When you give breaths, you always want to have that airway open, which is tilting the head back. Pinching the nose, but with these, you don't pinch the nose. It just goes over their whole face. And you want to make sure that there's a proper seal. It's not hanging over their chin, because then the air just will go out instead of into the person's mouth. I think that was all that I wanted to say about that. Yeah, so I'm now going to move over to the floor, and you can see the difference. CPR is made up of two things: compressions and giving breaths. Those are the two most important things. If you are giving breaths, you never want to interrupt compressions no more than 10 seconds. So if you're giving breaths, and whenever you give a breath, you always want to look down to see that chest rise. If you give 2 breaths and you see that the chest isn't rising, you could try 2 more. If it still doesn't rise, you just go back into giving compressions and you'll try again. So you always do 30 compressions, 2 breaths. The ratio is 30 to 2. So you always want to do 30 compressions, 2 breaths, at least 5 sets. It can get tiring if you're doing it on like a child or an adult, because it's a lot harder. You have to push harder, and you might eventually break a sweat. But if there's someone around that knows CPR, you want to alternate. So you do your 5 sets of 30 compressions and 2 breaths, and then they do their 5. In the US, it still takes 4 to 10 minutes for the paramedics to arrive. So even if you did call 911, that's the first thing. You always want to call 911 first. And sorry, I was reading the comments. Always call 911. If it is an infant and you're alone, you can carry, if you don't have your phone next to you, you can carry the infant to phone 911, since they're much lighter and you can just carry them. But with an adult or child, leave them, go call 911, bring the phone back to the scene, and immediately start CPR. And you always want to check for their breathing as well. If their breathing looks off, if they're like gasping for air, or their chest isn't rising normal, it's like it's not normal, that's when you give CPR, even if they're unresponsive. Now, if they're unresponsive and their breathing looks normal, just roll them to their side and wait for the paramedics to arrive. So we're going to now move to the floor. I'm going to take my device. Alrighty. I hope this looks good here. So this is the adult mannequin. I'm not going to use the mask or anything. I'm going to get a good angle here. So the mannequins have clickers. They also have lights. Now, in my class, I never teach them about pinching the nose. The heads move as well. So you see this slight movement. The head doesn't need to go too far back. It just needs to go back a little bit to open that airway. These mannequins also have lights to keep up with your pace. Sometimes it'll blink yellow, which means you're either going too fast or too slow. But, I just watch to make sure. I'm like, okay, yeah, I can see that you're doing good. Sometimes these might be a little bit sensitive. But depending on which is your dominant hand, or just whatever feels more comfortable. Since I'm right-handed, I like to put my left hand on the mannequin and my right hand on top. And I use my right hand to grab my hand like this and to help push down. And you want to make sure that you keep your elbows locked. So you don't want flimsy elbows. So it takes some strength. I'm just going to give one compression just so you can see the lights. So those 2 lights there on the shoulder. So red, once again, is dead, that blinking red light. So 30 compressions, 2 breaths. I'm not going to do 2 breaths. What I was saying earlier about pinching the nose. Pinching the nose, you want to make sure there's a proper seal between your mouth and the person's mouth. If there is one of the masks available, like if you have a little pocket mask, or if you have the face shield, those are great. The pocket mask just goes over their mouth. Don't have to worry about cross-contamination. And also a valve And then, again, I don't want to take all of this stuff out because I do have a class later. These for the students, but this is a one-way valve and it'll go into the mask. So, and then it'll go on here. With the mask, you hold it down in place, lift their head up. If you don't have this, pinch their nose and still pull their head back. And you want to make sure there's a proper seal. Your whole mouth is covering their mouth because you want to make sure that air goes in there. And you still want to look at that chest rise. So, if you could see, "30 and 2 breaths." So, I'm not sure once again if you guys could hear that clicker. It clicks for you. So once I stop, I'm live streaming. So once I stop, it blinks red. So I can't really see the comments. I'm not sure if someone asked a question. But the AED, I could demonstrate that for you guys as well. It's just a little bit loud, and I'm not sure if you'll be able to hear it on camera, but I'll grab those for you. I wish I could see the comments right here. So some AEDs are different. All of them are pretty much the same, but they just might work a little bit different. Like the instructions. So this is the AED. This one you have to turn on. Some AEDs work where as soon as you open the lid, it's automatically turned on. And then these are the pads. So they come with a plastic backing. You peel it off, but we're not going to actually put it on the mannequin because it'll be a nightmare to get off. So plug in the pads connector. And then you plug these in, the pads to the pad connector. And then all AEDs have instructions, so you just follow the prompts. And if you look at these, they have images. So this pad will go on the side here. And then this one, sorry, sunlight, will go right up here. Sorry. So I'm not going to actually stick it on the mannequin because they are really sticky. Now, another thing, if someone is in water, you cannot work these. If they're laying in snow or a small puddle, you can still use these. Just wipe off the chest and stick them on. You don't want the chest to be wet. Then that could also that will make the shock travel through the water and not give an effective shock to the heart that needs it. If some people might have a lot of hair on their chest, some AEDs come with razors. You want to shave that area off first, quickly. It doesn't have to be super neat, just so these have a good stick. If an AED comes with 2 pads and no razor, you could put the pads on. The AED would say check pads. Try to push them down a little bit firmer. If it's still saying check pads, what you want to do is rip the pads off forcefully, and which is ripping off the hair. It's kind of like a wax. Rip them off. Take these apart. And then get a new set of pads. So you can put on a new set, like these here. But we're going to still use these ones. So I'm going to turn on the AED so everyone can listen to what it says, and we are just going to follow the prompts. Just need to hear it.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient.
and you don't want to touch them.
Deliver shock now. Press the orange
This-
button now.
This button's blinking. You press it.
Shock delivered.
Shock delivered.
Begin
And then you
CPR.
resume. And this one has beeps. Some of them are different, might not have beeps. But you can still give CPR with the AED pads connected. So, again with compressions, even though there's a song, people say like the Staying Alive song, that song's actually too slow and you want to count. You want to make sure that you're counting 30 instead of singing the lyrics. So, that's also another thing. Although it's on the AHA, which I'm not really sure why, but we don't teach that. That's just an older method. Over time, things change. Just like one thing that I know has changed for the 2020 update is for infants, the compressions. You can now use the palm of one hand. At first, that was never a thing. You never wanted to use your hand. Always use your two thumbs, or even like your two fingers here to press on the chest, which I'll show you. Your two fingers here. So and whenever you're giving compressions, you always want to make sure that they're laying on a firm, flat surface. If they're laying on a bed and you're giving compressions to like the adult, their body is just sinking in with the bed, and you're not giving it an accurate compression. And you're probably not pushing hard enough, because as you're pushing down, their body's going down into the bed. So you always want to make sure they're on a firm, flat surface. So with an infant, right at the center of the breastbone, and you can use two fingers like this, or two thumbs right at the center of the chest. And if you can't do that, the palm of one hand. But you just want to make sure that you're not pushing too hard. So now I'm going to go over just briefly the choking part, because there was a video I did see on the internet at a restaurant, and this baby was choking on a piece of pancake. No one in the whole restaurant knew how to help, and she was like, at first she was just lightly, she had the baby laying flat on her, across her, and just doing these light taps. Now, yes, sometimes you do want to just let them cough it out. Like if they're coughing, let them cough. Once it starts getting more severe and they start changing colors, that's when it's now getting serious. So, this laying flat, this isn't it. No. You want their head to be lower than their feet. Their feet, they should be at a 45-degree angle. It's best to do this when sitting, because after a while it could get even though they're infants, it can still get a little heavy. You want to and this is also gravity. Gravity is helping get that item out of there. So you want to do 5 back slaps. So 1, 2, 3, 4, 5. You kind of want to thrust. So like, and don't be afraid. You know, people always tap them because they're babies and they're infants. You don't want to hurt them, but you know, you still want to get that out of there, because you know, would you rather just hit them a little bit harder, or you know, something worse could happen. It could lead to something else. So 5 back slaps. If you don't see the item fall out, turn them over, see if you can see it in their mouth, and pull it out. If you don't, you're going to still keep them at a 45-degree angle. You're going to do 5 compressions just as you would during CPR. So 1, 2, 3, 4, 5. Turn them over again. 1, 2, 3, 4, 5. Turn them over, look in their mouth. 1, 2, 3, 4, 5. And you want to do this pretty quickly. You don't want to 1, 2, 3, 4, and you want to stay firm and consistent with your taps and compressions. So if you can see it, grab it out, or if they spit it out when they're this way. So I feel that's very, very helpful for parents to know. A lot of parents don't know that. And that is pretty much it. Those are the basics for CPR. And I'm now going to move back up to the table. And anyone could just ask any questions if they have any questions.
Micaiah, thank you so much for the demonstration. It does help to see exactly how to position your hands, how to position a baby, especially. I recently just saw a news story where the parents were jumped out of their car. Their baby was choking or something. They didn't know what happened, and they were just screaming. And luckily, there was a police officer nearby. He immediately held the baby exactly like you said. Luckily, he was there. He jumped out, held the baby like you said, hit them on the back just like you said, and then what was lodged in their throat came out. So thank you for stressing that, and also stressing the point that as hard as it looks that you're hitting them, it doesn't hurt because you have to get whatever is lodged in their airways out.
Yes.
So the same thing for CPR. I think it's important if you could stress when you're doing compressions, again, the strength that you need to do. If you could just show that hand placement again one more time, because that's crucial. And then, how fast you have to do that, because I think people also think they're going to hurt someone. Like you said, if you might break their ribs, it's getting their heart started, their ribs will heal. But if they miss that window of opportunity to get their heart started again, then it's too late. So I've heard many times that people do it too slow or they do it too lightly because they're afraid to hurt the person. But you do have to use a lot of strength, and it doesn't matter your size. Like, you're a small person. If you're a small person, you can still use a lot of strength.
Yeah, and also I've had people ask me, like, what is the age for people to get certified? And there's really no age limit. It's all about strength. So if you're a strong 10-year-old and you can give 2.5 depth compression to an adult, then you can get certified. Like counting, if you keep up with numbers as well. So it's really just about that strength. Some elder people might have like arthritis and they really can't give that compression depth. It's still just good for people to learn. So even if you can't do it, you can maybe help someone else do it. Like if you have like a broken hand at the time, like, well, I can't do it, but I can tell you how to do it. So, and like coach them through it. But so the compression rate is 100 to 120 per minute. So you're going to do 30, and you want to make sure you're doing like one compression a second. And you always want to let that chest come all the way up before you go back into the next one. That's called recoil. And you don't want to like keep their chest super like down. So you want to do one, let their chest come back up. Another one, let their chest come back up. But the rate is about 1 per second. So about 30 seconds, you should have done 30 compressions, because the ratio is 30 compressions, 2 breaths.
That's another excellent point, 30 compressions. And I think some people think they're hurting someone. They have to keep going. And then let's also stress the importance of calling 911. So I have heard in other instances, we talked earlier about the bystander effect. Not only do people not know CPR in certain communities, and this demonstration has helped many people at least know the basics, but people forget to call 911 because they're very upset and scared and they don't know what to do. But reiterate, I think you have some statistics, or you might be able, we could put that in the chat later, about the incidence of calling 911 because of the time lost you cannot get back.
Right. So the steps are, because I give these little cards out during my class. So step 1 is tap and shout. Well, first, you want to make sure the scene is safe. So if you're approaching someone that's been like, they're in glass or something that could possibly hurt you, you want to get them out of that area, because if you get hurt as well, then, that's kind of just, you won't be able to help them if you're hurt yourself. So you always want to make sure the scene is safe. Tap and shout, see if they're responding. If they aren't responding and their breathing looks off, that's when you want to go into giving CPR. And you still want to scan their chest, like after you tapped and shout, if they're okay, if they're not responding, look at their chest, look at their breathing. If their breathing is off, or if their breathing is off, that's how you know you need to give CPR. If it looks normal, just roll them to their side. This is really a good demonstration for the mannequin, but roll them over to their side and just wait for the paramedic. So you always want to tap and shout, shout for help. If someone else is around, they can go call 911 for you and get an AED while you go straight into giving compressions. If you are alone, you want to run and get your phone, or if you have it on you, dial 911 and put it on speaker. And then you can give compressions. Also follow the dispatcher's instructions as well, whatever they might be instructing you, but you still want to call them. And answering their questions won't delay the arrival of the paramedics.
That is a very important aspect of calling 911. Thank you.
Yes.
So we had a question. Thank you, Regina, who asked a question about how to receive the actual, like your training class. I think we can put that in the chat on how you can receive the actual CPR training with the equipment and get certified. Could you just explain that process?
Yes. So, with my classes, they are about 2 hours, and you will get a chance to work on all the mannequins, the infant, the adult, and the child. I just didn't show the child one. I do have, let me see, how could I? So I do have I'm working on the website, because this whole academy, we do firearms training and CPR, so I'm under that. There's a website I can put, am I able to like put the website in the chat and then like my email, so if anyone was interested in the class, they could.
Yeah, we did share your email, and
Okay.
then Morgan can also put in the your website. If you send that to Morgan, we can put it in there for you.
Okay, for sure.
Okay.
But with the class, you will get your course completion card once you've completed the course. Which is your certification card. That is valid for 2 years. Every 2 years you have to renew it, which is just taking a class. It could be any class. I've had a few students who were, they were new to taking my class, but they weren't new to CPR. They just needed the renewal. Because also the AHA does that just so it stays fresh in your brain. Because even if you don't, like within the 2 years, you don't provide any CPR, you might forget it. So you might not know the steps. You forget some of the steps, just so everything stays in your mind. And just over time, things do update. Like the last time it was updated, there was a 2015 update, and then there was a 2020 update. So just a few things changed when you was talking about like the Black communities. That is now updated in the new AHA course. And just different things with the infant and everything. But I do feel that it is very important for everyone to know. And some people feel that they don't really need it. They don't work in an area where it's required. But I think just it's a basic skill for anyone. And it looks just even if you put it on your resume, it just looks very professional. It looks good, and everyone should just learn it.
Absolutely. And I'll just say, even when I came to work as a commissioner at Cook County, the AED machine is located right outside my office. And so as a kind of conversation to the more than 50 people who work on my floor, I said, does anyone know about this AED machine? And they were like, oh my God, I never even noticed that before. So it's great that you showed how that works and that the instructions are actually located in, because again, it's something that scares people. They say, oh, if I put that on someone, is it going to hurt them? But
Right.
the steps are listed there. And I think it's important for everyone. I'm glad Felicia, who is in our comments, she also said she's going to locate try to locate the AED machines when she goes places. So it's another
Yeah,
good step for all of us to just be aware when we're
right.
in a location, especially if you work in a location every single day. Where is the AED machine at
Yes.
your office?
Yes.
And that is a thing you can practice with the AED machine in your office. And
Mhm.
American Heart Association also teaches that in your class as
Yeah.
well. So thank you for sharing that information. There's a lot of people on here. We even have somebody on here today from California. Thank you for joining
Nice.
us. So because this is universal, I mentioned the statistics for Cook County, but heart disease is the leading cause of death in our country, but pieces of that are part of what was mentioned here that can cause cardiovascular disease related to CPR. So it all goes together in one way or another, where we're able to help save lives by improving our own education, but also improving the outcomes of someone suffering from a cardiac event. So with that, Micaiah, do you have any closing remarks?
I think that is all. If anyone just had, I was trying to see if anyone had any questions that I was looking at. But yeah, just again, if you are in a workspace where there's an AED, or you just familiarize yourself with it. Just know where it is. So if you say, hey, someone go get an AED, and they're like, where is the AED? You could say, oh, it's on the third floor on the wall to the right, or right next to the stairs, wherever it might be. Just familiarize yourself with it. When when like I would go anywhere with like my parents or something, and we would just always like spot an AED. At first we were just like, oh, we just walk past them and just don't notice them or don't really care about them. But now, like, when you become aware of it, you see things more. So you're like, oh, there's an AED everywhere we go. Like, oh, spot the AED. We play a game called Spot the AED. um but just familiarize yourself with it. um Someone asked, where do I teach CPR classes? So my office is located in Linwood, Illinois. It's right on the border of Dyer, Indiana. So I get a lot of students from Indiana. Um, I do have some. I've had Most students have been from Indiana, but the certification pretty much works everywhere. Once if you're certified in a certain state, all CPR is the same. So it doesn't really matter about what state you're in. But yes, I do teach in Linwood. Um, where can I buy the plastic mouth guards? So actually, give me 1 second. I'm gonna actually grab one just to show. So these ones actually are mine, so I can open this to show you. So, this is mouth guards. So these are the face shields that I was talking about earlier. So you open it, there's plastic, it's plastic, so you open it up. And these are a one-time use. So once you've used it, you just throw it away. You don't want to use it twice because then it's cross-contamination. You don't want to spread germs. So this will go over your mouth. And once again, I want to actually put it on my mouth since I don't want to use it. It has instructions. So the top part goes here. And this valve goes where your mouth is. So that's just so it's a one-way valve. So the germs from the person isn't getting into your mouth. And it's pretty much just a filter. But you can buy these. You can buy them on Amazon. Actually, these ones that I give them to my students. I got them from Amazon. So you can just look up CPR face shield or CPR face mask, and they'll pop up. And you can put them on a keychain. They're very good to keep, but they are one-time use. So after you've used it, you throw it away. But if you buy like a pack of them, then you're pretty much set, and just keep switching them out whenever you use them.
So Micaiah, can you also talk about if we don't have that part, if we don't have the face shield and we don't do the mouth to mouth, is the hands only part effective?
Like just hands only with no breaths?
Yes.
Yes. So, once again, if you just don't feel comfortable giving breaths at all, just do compressions. Just keep doing compressions. just do 30. You just ignore the two breaths. You do 30 compressions. Another 30, you could take a pause if you get a little bit tired. So just as long as it will take to give 2 breaths, you can just take that time to just pause for a second, go back into doing another 30. Even though the breaths part is very effective. So that's why I feel that it's really great to have these, or if you just, you don't mind putting your mouth on someone, especially if it's someone that like your sibling or a parent, then, it might not be as much as an issue without like touching, because, and then just with COVID and everything, you might not want to put your mouth on other people's mouth. But I feel these are great. And the breaths, that's what I teach. That's what the AHA wants everyone to learn, because that is super effective. So CPR is made of 2 things, breaths and compression. So those 2 things are very important.
Well, thank you. And then some more people are asking questions about where your class is. So I just want to remind everyone, we will put the actual class information in this chat. So we'll have that and put your website on there. And also we can put the link where you mentioned where you could buy those face masks or facial shields. Well, we can put a link in there where people can get those as well. So a couple people are asking for that. So, well, thank you, Micaiah. Thank you, everyone, for joining us today. I'll just, say that it's so important to know CPR. For those of you who work in any kind of environment, whether you're working virtual or in person, encourage people to learn CPR. Trainers like Micaiah can come to your workplace or do virtual in this instance. But the good thing is that we're raising awareness about the importance of having and knowing CPR. And it's also, someone put, will you be able to teach for a group, Alpha Kappa Alpha sorority youth group? Yes, it's so important for students to learn CPR. And I think in Chicago Public Schools, it's part of their curriculum now, that they have to learn CPR before they graduate. So students can save lives too. Yeah. We've seen many instances where the kids are the ones who jump into action before the adults because they've learned it at school. So Micaiah, I think you're going to be a little busy with people reaching out to you for your class, which is great. And you can also refer people, like if you get too busy, there's other trainers as well, right? Through the American Heart Association. But I will also put in the chat for this, the link to American Heart Association, where there's more information just about the importance of CPR and AEDs. But I think the final takeaway message is that, to jump into action and try to perform CPR if you're able to call 911, and to know where an AED machine is located in your place of work or someplace you might go quite a bit. If you go to a certain restaurant, they're in restaurants. Also for people who travel, they're all over the airports. It's just good to kind of make a spot check to see where those are. So I'll close out with that. I really appreciate everyone joining us on this Saturday morning. If you have other people who might want to see this presentation, it will be on my Facebook page, and you can share it from my page, Cook County Commissioner Donna Miller. And we do want to thank you, Micaiah, for your excellent presentation and professionalism in doing a great job in raising awareness during American Heart Month in this February. So thanks so much, everyone.
And one more thing before I close out. Sorry.
That's okay.
I am having one last class for this month on the 18th. I was just looking at the comments and someone was saying, how do I sign up? My email is in the chat. It's just micaiahisaac@gmail.com. You can just email me saying that you're interested. And then I can also send you the schedule for like any next class. But I do have a class next Friday. If you're interested, I think there's 3 seats left because I can only do 6 students per class. But just reach out to me if you're interested. It is in Linwood, and she did put the link to the American Heart. So even if you don't want to come out to Linwood, you can search classes that might be a little bit closer to you. And there's classes just everywhere. So just wanted to throw that out there.
Awesome. Great. Well, everybody have a great Saturday, and don't forget to learn CPR. Thank
Yes.
you.
Bye-bye, guys.